I'm Miss Flanagan. I'm going to do, what are you here for today?
Here to get a checkup.
Okay, what's your full name?
Thomas Ligon.
Okay, what day is today?
That is October 1st.
Okay, and where are you?
I am at the health system right
All right. So the first thing I'm going to do, and I'm not going to actually do it because y'all know you'll have to do it. First thing I got set up, my vital signs. So I'm doing my vital signs, and I'll have that post-it note where y'all can actually write down the vital signs on it. Okay, so I've felt his pulse for the vital signs, so I'm here. So I'm going to go ahead and feel the muscle tone too. I'm feeling temperature. Radial pulses. Capillary refill. Okay, get you to lift up your arms like this. Now pull against my hands. Good. Now push my hands away. Good job. Okay, so then they're in their gym shorts, so you're feeling their legs. And then you're going to do your pedal pulses. You're checking for any edema. Capillary refill. Push my hands away with your legs. Good. Now pull them back towards you. Good job. Muscle strength is done. Musculoskeletal is done. Okay? So you're going back up to the eyes. Get you to read the smallest line you can for me.
426.
Okay, and what number was that? All right, so 20/20 vision. Okay, and what's on the wall over there?
It's fire.
We'll have a poster or something of for y'all. Okay, so we've done visual acuity. He's not having any trouble reading. So I'm going to get you to look straight ahead. Check it from, go in. And you're watching those eyes constrict. So pupils are equal, round, reactive to light, accommodation isn't necessary. So I still got my pen light in my hand, so I'm going to get you to open your mouth, stick out your tongue for me. Good. All right. So I'm looking at the mucous membranes. They pink? Are they moist? Is there cracking? Is their tongue black? You never know. Yep. Okay, so we've done all that. Facial symmetry, face is symmetrical. He's not having any problems with communication, conversational speech. So facial sensation isn't necessary. So we're not going to do the light touch or anything. Okay. Anything else I need to do on this part? Anything I'm missing?
Mm-mm.
No?
So we don't do the ears, do we?
Mm-mm.
Okay, cool.
Mm-mm.
So like, what if his nose is like a little bit crooked? So we gotta like mine is crooked.
Yeah.
Right. So we gotta open that.
Yeah, you would say,
Oh,
you know,
the
a
ears.
noticeable nasal deviation to the.
Wouldn't be on ears.
Okay. The way that's it.
Mhm.
Okay.
Ears,
Okay,
not
so at this
eyes.
point, we've done all that.
Bigger.
So this would be a good time to check your sheet, to make sure you've hit everything you want to hit in the order you want to hit it at this point. Then you can go back and do it if you've missed it. Okay? So at this point, I'm not going to make him take off his shirt, but you're looking at color. You're feeling it. You might go ahead and palpate for temperature on the chest, but then you go to the back. So the first thing you're doing is you're palpating for masses, you're palpating temperature, all down his back. You got your stethoscope. So you're, every time I move the stethoscope, I want you to take a deep breath in and out. You listen bilaterally. You listen to those apexes. And then after you listen to about 6 spots on your lungs, you're going to listen to your laterals. Remember, you do this bilaterally too.
Is he taking a slight deep breath every time?
Okay, so at this point, you're done with the back.
So are you telling him to take a slight deep breath every time your stethoscope
Every
touches
time
the
the
back?
stethoscope
Okay,
moves.
cool.
And then if you feel like they're getting labored doing it,
Mhm.
their breathing's getting labored, we can take a break.
Okay.
Or tell them to just, we'll slow down and stop if you need to. Okay? So you've done the back, you've done the lateral. What do we do next? Anterior lung sounds. So you're listening to all those spots. In women, you may only be able to listen to up here and down here. Okay? So you're doing the breaths. need to listen to?
Heart sound.
Hearts. So you're listening to aortic, pulmonic, hertz, tricuspid, and your mitral. So then you're gonna flip it, and then go back with your bell to all your spots. Okay?
But we
Without
go back
forgetting anything.
Palpate.
You can go back up, or you can go start back from the top.
Okay.
It doesn't matter to me.
Okay.
Will we palpate?
Yep, I got palpate.
Oh, you did that.
Anterior chest. Okay, so we're done with that. So I'm gonna get you to scoot back for me. And lean back. Okay. I'm gonna get you to turn your head that way. I'm gonna shine a light on your neck. So you're looking for any jugular vein distension. You should see the normal pulsation right here. And you're gonna palpate carotid. I'm gonna get you to turn face me. And you're gonna do the same thing to this side. Then what are you gonna do? With the bell, what are we listening for?
Auscultate heart sounds.
Heart sounds?
Carotid.
Carotids.
Okay.
What are we auscultating for in the carotids? Bruce. So I'm gonna get you to turn your head back. So if you've noticed a problem, maybe with the jugular veins or palpating the carotids, what might you get your patient to do while you're auscultating for bruise? Hold the breath. That way you're not getting lung sounds confused. Okay? So we've done all that. I'm going to get you to lean up for just a second. And this bed will pinch you. And that one will not lay down all the way. So
Oh, yeah, it's because it's long.
Yeah.
Sweet.
okay. So you're looking tangential light. You're looking from the side. It's flat. I'm going to get you to do a little bit of a crunch for me. Okay, and you can see muscle tone. Okay, good job. And making sure there are no masses or anything like that. So make sure you flip back to your diagram. And you're going to auscultate. Okay, so he had active bowel sounds in all 4 quadrants, and then you're going to palpate. And I usually use 2 hands. Some people just use 1. You got that light palpation. You're covering everywhere. Go around the umbilicus. So you've done light palpation, then you do your deep palpation. I don't feel any masses or anything. So that's it. At this point, look at your card again. See if you've missed anything.
So would you not auscultate the heart sounds when he's lying
I
down
didn't
at a,
auscultate the heart sounds when he's laying
at
down.
a 40 when he's laying flat or at a 45-degree angle?
Flat.
Flat.
Mm-hmm.
And that's it,
So
isn't
you
it?
listened to the heart 4 different times. Did I miss anything else?